Okay, hello everyone. We're going to begin. We're very privileged today to welcome Shelly Sundberg, who is Interim Director of the Adaptive and Equitable Food Systems Programs at the Bill and Melinda Gates Foundation. We now live in turbulent times, so the Bill and Melinda Gates Foundation, I'm sure, is overwhelmed with requests, overwhelmed with demands, and basically it is a very difficult time for everybody. So we especially appreciate Shelly for coming here today and for discussing with us ways to develop nutritious food systems in both Africa and Asia. Shelly has a long experience at the Bill and Melinda Gates Foundation, having been there for several years. I think she joined 16. In 2008 or thereabouts. Yeah. And she has worked in any number of countries of interest to us, including Mali, Burkina Faso, Niger, and other countries in sub-Saharan Africa. And she'll tell us exactly about the various initiatives that the Bill and Melinda Gates Foundation has in place. So please welcome today Shelly Sundberg.
Thank you, Dr. Drewnowski. Can you hear me okay? Okay, great, thanks. Just a couple words about myself, so I'm not a complete stranger. I actually grew up in Seattle, went to Blanchette High School, and then went away to university and then went and lived in West Africa, as Dr. Drewnowski said, for several years. And I've been at the Gates Foundation since 2008 with a background in both agricultural economics and global nutrition. So that was my training. Just a couple words about the Gates Foundation. As Dr. Drewnowski said, we're living in a very turbulent time with the shuttering of USAID in the last few weeks. FCDO, the British aid agency, just announced a pretty serious cut to their overseas development assistance just this week, and their minister resigned. So there's a lot of turmoil in the international development community, which definitely has impact on us because a lot of individuals and organizations are coming to us to help plug gaps and holes. So it's very challenging. Overall, at the Gates Foundation, just a couple of introductory remarks on our general work. We regard ourselves, Bill and Melinda Gates have always said they're impatient optimists working to reduce inequities around the world, focusing on the areas of greatest need. Most of our work outside, we do have work in the US, mainly focused on education, but globally, it's mainly in sub-Saharan Africa and South Asia, the lowest income countries in the world. And our overall vision is that every person has the opportunity to live a healthy and productive life. The areas that we work in include child health and disease. So we work to ensure that children can get an education. We have a global education program as well as improved nutrition and health. I'm going to speak about the nutrition part of our work. And these good health, good education, we see as key pathways out of long-term poverty. We also focus on the most vulnerable, specifically women and young children, to lead healthy and productive lives. And a lot of our programs are geared toward women specifically. For example, the family planning program, maternal health, and within agriculture, the team that I sit on, we focus on women small-scale farmers. Then we also focus on infectious diseases that have often been forgotten by the global population because they aren't really a risk in the United States nearly like they used to be. HIV, malaria, tuberculosis, diarrhea are all still big killers of children and adults in the world. And polio as well is a disease that we're focused on. Bill Gates has the goal, the objective of helping to eradicate polio in the world, like smallpox was eradicated a couple generations ago. I'm going to focus today on our nutrition work and specifically our work on nutritious food systems, but we also do a variety of work on nutrition beyond nutritious food systems. So within nutritious food systems, which sits on our agriculture team, our focus is on increasing the equitable consumption of safe, affordable, nutritious diets year-round. So we're very focused on healthy diets. Our work on large-scale food fortification. Fortification is putting nutrients into food as they're being processed, like flour, oil, salt, adding individual micronutrients to those staple foods and condiments. That's the work of another team. And then thirdly, we also focus on maternal and child nutrition. That's both on discovering new products, doing science and R&D, but also making sure that the populations in which we work have access to products that we've had in this country for generations. One example there is prenatal vitamins that we take for granted in this country. If a woman becomes pregnant, she will start taking prenatal vitamins early in her pregnancy. In a lot of countries of the world, women don't have access to prenatal vitamins. So just that fairly simple, it's been around for many decades in the US and in Europe, is not so widely used in many parts of the world. So our agriculture team, I just wanted, I'm not going to go through this slide in its entirety, but it's just to show you, it's a very big team of the foundation. The annual budget right now is about $500 million a year just for agriculture. So we, the nutrition part of the agriculture team, we're a very small part of it. But overall, the team focuses on 4 goals, which are in orange on the right-hand side of the slide. Increasing the productivity of small-scale farmers, increasing their incomes, and then increasing the consumption of safe, affordable, healthy diets. So that's what we're focused on, and increasing women's empowerment in agriculture. And I can speak more about those. But so 4 strategic goals. A lot of agricultural teams or efforts throughout the world mainly focus on productivity and income. So I just want to highlight that having a focus also on healthy diets and women's empowerment is more exceptional, I would say, for an agriculture team. So what are the current state of food systems? What are we focused on? So food systems are a good entry point to improve nutrition because everybody eats every day. You have to eat. And current diets in general do not provide adequate nutrients to support healthy growth and development. You may have heard the statistic, but healthy diets, according to the Food and Agriculture Organization in their annual State of Food Insecurity in the World, are currently unaffordable for about 2.8 billion people. And those are 2022 figures, which is about 35% of the global population. And if you zoom in on Africa, you can see the darker colors there. It's almost 3/4 of the population in sub-Saharan Africa cannot afford a healthy diet. And what does that mean? It doesn't mean that 3/4 of the people are dying from a lack of food, because it's a healthy diet, meaning it's not just adequate calories, but it also gives all the nutrients and other components of a diet that one needs for healthy growth and development. So one could be buying just a lot of staple grains, corn or maize, wheat and rice, but that's not going to be a healthy diet if 70 or 80% of your calories are coming from one staple grain, in some cases a highly processed one. Diets today are also not sustainable. Food systems are a major driver of greenhouse gas emissions, and it's estimated, again, by the Food and Agriculture Organization of the UN that up to 1/3 of food that's produced is lost or wasted. It never makes its way to be consumed. So that's a big loss and a big source of environmental impact. Poor diets result in poor health. So these 10 factors listed on the left there are risk factors that drive global disease and global mortality. Those bars going across are millions of deaths per year. And you can see that the top of these top 10 risk factors driving global mortality, 6 of them are diet related, the ones in red. So some of them have genetic components too, but they all have a dietary component, the ones in red. So examples of that are blood pressure, obviously influenced by your dietary choices, fasting plasma glucose, so that's diabetes. And then dietary risks, sorry I skipped over that one, are things like eating too few fruits and vegetables, eating too much salt and sugar, directly related to mortality. Down near the bottom, child and maternal malnutrition, they really mean undernutrition there, so those are nutritional deficiencies mainly seen in low-income populations. So diets are a huge determinant of global health overall. We also know that situations like conflict, wars, climate extremes, increasing temperatures, economic shocks, and public health threats like the recent COVID pandemic put huge pressure on food systems and can both decrease the nutrient content of crops, the micronutrient density of crops, and reduce the yields of crops too in the face of drought or heat stress. So climate change, economic and environmental volatility, all those factors are increasing the pressure on the food system and its ability to supply healthy diets. So what are we doing? What does our grant portfolio look like? We're a grant-making organization. We fund NGOs, we support governments with funding, we support businesses, we support academic research, but our bread and butter is making grants to those various organizations in line with strategies that we've developed for what we see as the most salient problems and the most promising solutions. So within our work on nutritious food systems, again, we're trying to improve the consumption of healthy diets, and we work to address these barriers that you see in red there. So the availability of healthy food. Is it available in the market where consumers shop, where low-income consumers shop, not just in cities and capital cities, in grocery stores or supermarkets, but in rural markets or in urban areas, in slums or ghettos, as they say, where low-income people live, more informal outdoor markets. What food is available? How affordable is that food in the markets? Is it unsafe? There's a big problem with contamination of food by pathogens, bacterial pathogens, viral pathogens. Also, there's adulteration of food where water, powder, for example, are added to milk to make the volume grow, and there's not really a lot of regulation of that. So how safe is the food supply? That's a threat to healthy diets as well. Knowledge of what is a healthy diet. There's still a lot of thinking, even among educated people, that a healthy diet means getting enough calories, eating enough food. And that's especially true in countries that have had longstanding problems with food security, with famine. It's still just a matter of getting enough food and not a clear recognition that you needed a wide variety of foods, a diversity of foods to really have a healthy diet. So there's a knowledge component to that. We all know knowledge is not sufficient. We probably in this room generally know what a healthy diet is and we maybe can afford a healthy diet, and it doesn't mean we're necessarily eating it. Empowerment of women. So this is ensuring that women have the decision-making ability to act upon their knowledge. There's several studies that show that additional income in the hands of women, at least in the countries where we work, is more likely to be spent on food and health for their family compared to additional income in the hands of men in those same countries. So wanting to be sure that women are able to make decisions about what they grow on their farms, about when and how they sell what they grow, and then what they do with the income from those sales or from whatever sources they have income. And then economic and environmental volatility. And I spoke a little bit about this, but trying to ensure that food systems are resilient to the environmental and economic shocks that come their way by connecting farmers to markets and assuring that there's a stable enough supply of food and that value chains don't just shut down when there's some kind of shock. And I would also emphasize that our work on nutritious food systems addresses both undernutrition, meaning not getting enough food and nutrients, as well as overnutrition and chronic disease risk. In Africa and Asia, the rates of heart disease, diabetes, et cetera, are much lower than they are in high-income countries, but they're growing, and they're becoming more significant for those populations. Our nutritious food systems portfolio focuses on 4 different areas, and I'll speak about each one individually. The first one is increasing demand for and consumption of nutritious foods, so characterizing diets and trying to incentivize the consumption of healthy diets. What are those demand-side interventions you can support? The second is improving how markets work for nutrition. There we're focused, as I've kind of alluded to, on addressing food safety, ensuring that food is safe all the way through the value chain from producer to consumer, and ensuring that we're trying to decrease food loss as well throughout the system, from when the food leaves the farm all the way to when it reaches the consumer. And I'll show a slide on that. And then integrating nutrition into agricultural policies and programs. As I mentioned, a lot of agricultural ministries and a lot of donors since the 1950s or 60s, when there started to be sort of a development world, have been very focused in agriculture on the big 3 grains, on maize and wheat and rice. Much less investment in fruits and vegetables, legumes, dairy, eggs, fish. So wanting to ensure that when a Ministry of Agriculture is designing its priorities, that they're taking nutrition into account in their programs and looking at impact on nutrition. And then lastly, integrating nutrition into food production and processing through fortification and biofortification. So where do we work in terms of the value chain going from what's called farm to fork? Our different programs work at different parts, but we do go all the way from food production through to consumers, although most of the people on our agriculture team mainly focus on the food production part of things. But our work on biofortification and fortification spans from the food production through to the retail markets. The work on improving markets is situated in the middle of the value chain from storage through the retail sale of the food to consumers. Increasing demand and consumption is focused on food environments where consumers come to the market to buy their foods and on consumption within the household, those consumption decisions. And then integrating nutrition into ag policies and programs really spans across the value chain of food. The first area of focus for us, increasing demand for nutritious foods. This little graphic shows that there are many drivers of why we choose to purchase and consume the food that we do. I alluded to some of them before, like affordability, availability, but also food environments. What food is available? If you only had stores like convenience stores like we have here, like a 7-Eleven, I mean, you just know when you go into stores like that, there are very few unprocessed foods, just natural foods. If those were the main sources of where you could access food, your choices would be very constrained. Compared to, we might here in Seattle have access to farmers markets and grocery stores with a lot of variety and diversity of offerings. Cultural norms and preferences play a huge part in our decisions on what we consume. Different cultural traditions, taste preferences can't be ignored. So those are all things that need to be accounted for. Convenience. As more and more people are joining the workforce, people want to have quick access to meals. They don't want to be required to prepare a meal for 3 hours in the evening. So you see more and more demand for convenient foods that are quickly prepared and partially processed. Perceptions of food safety. We're aware in some of the countries in which we work, some people have preferred vendors at their markets because they don't trust some of the other vendors in terms of issues like adulteration or just having clean hands. So when you do interviews with consumers in various markets, it's really interesting to understand their thinking process when they go into a market, how they decide who to buy from and why. And then nutritional knowledge, which I touched on before. So unless you have a fairly nuanced understanding of all these different drivers of food choice, it's going to be hard to design programs to meaningfully change what foods people purchase and consume. Some specific investments that we have in this area of increasing demand for nutritious foods are, we have some projects on our agriculture team that focus on increasing the productivity and income of farmers who focus on fruits and vegetables, legumes, fish, dairy. And so we layer on a nutrition component to those projects and also a women's empowerment component. For the nutrition, it's about ensuring that some of the food isn't just sold and goes off to high-income consumers in cities, but some of it stays in rural markets and makes those foods more available in rural areas. Also, there's often a nutrition knowledge component. It's called behavior change communication, but trying to ensure that families are aware of what constitutes a healthy diet, who in the family specifically, generally women of reproductive age and young children have elevated nutrient requirements, so it's very important for them to have a nutritious diet for the health and growth of their children. All parents want their children to grow up healthy and strong and smart, so appealing to those aspirations. And then a women's empowerment component as well. Again, what I was speaking about earlier, it's sitting down with men and women in groups and talking about how does decision-making work. Obviously, these are really sensitive issues, gender roles in the family for economic pursuits of the family, but it is possible to budge those norms and ensure that women, if not have full control over what they grow, how they sell it, what they do with their income, have some contribution to those decisions. So that's what we're aiming for. in providing technical assistance to countries to design and then administer food consumption surveys. In the US, we have a national food consumption survey every 2 years. It's called NHANES. It's a joint effort of our Department of Agriculture and Department of Health and Human Services. Most countries that we work in Africa and Asia have never undertaken a food consumption survey. So little tiny ones in projects, but never a nationally representative one. So we have been supporting several governments to undertake their first ever national food consumption survey so they can actually see what different populations in their countries are consuming, see where the gaps are, what does the consumption of highly processed foods look like, where's their vitamin A deficiency in terms of intakes, et cetera. So there are about 10 countries in Asia and Africa that have recently done that just in the last couple of years, and they're starting to use that data to inform programs to improve nutrition across multiple sectors. And then we've also supported projects to try to directly increase the consumption of healthy foods by intervening with market-level actors like vendors. And one example of that was a project that just recently ended in Nigeria called Fruits and Vegetables for Nutrition. The interventions were co-designed with consumers in low-income urban neighborhood in Ibadan, Nigeria. And they involved things like changing how fruits and vegetables were displayed at the market in terms of shelving, in terms of posters, in terms of aprons, to just make them very attractive. There were also meetings with community leaders, religious leaders, celebrities in the communities, and there was a whole marketing campaign around fruits and vegetables. And there was a randomized control trial to look at the impact of these interventions. It was done in Ibadan, Nigeria, and also in Hanoi, Vietnam, so one African, one Asian city. And there was a positive impact after an 18-month intervention on low-income adult consumption of fruits and vegetables as a result of market-level interventions. So nobody went to the household. It was just, we changed the market conditions, the food environment, and it had a positive impact. So I'm excited about those findings because there are very few examples of interventions directly intervening at market level that are sustainable, not just giving people vouchers. That is a great thing to do, but it's generally not sustainable because nobody's going to be able to do that on a large scale long term. But there are ways, it seems, to be able to affect consumer choices just by taking relatively inexpensive interventions with vendors at market level. So we're excited to build upon that. Second area of work, improving markets for better nutrition. Why do we focus so much on markets? There's a perception that many low-income people in Asia and Africa are subsistence farmers, and it's not really the case. It's kind of an outdated notion. This graph is from World Bank data, and it shows the percent of food that's consumed in the household that's purchased on the market. So you have Senegal, where 93% of food that's purchased, this is urban and rural households combined, so just nationally, 93% is purchased on the market. The lowest is Uganda at 59%, so you can see that well over half, up to almost 100% of food in these countries, which have millions and millions of farmers, is purchased on the market. So if you're going to affect nutrition, you have to work at market level, not just on farm. Another issue that I've alluded to earlier is food loss and waste. So in this graph, it shows where food loss is occurring in the market depending on the geographic region. So in the far left, you can see for North America, most of the food loss and waste occurs at consumer level. That's the pink portion. If you go all the way to the right, that's sub-Saharan Africa, and you can see that the food loss and waste, very tiny portion is the consumer, the pink. The vast majority is on the farm and right after farm in the storage and handling. So it shows you where you need to intervene if you're going to try to decrease food loss and waste. You have to take the specific environment into account. It's estimated that food loss accounts for $400 billion in economic losses annually. So it's a huge, huge problem that's just starting to be recognized and focused upon. And then the food safety issue. So here, in a lot of the countries where we work, there's hardly any cold storage. I mean, we take that for granted here, that when food is harvested on a farm, it goes into transport that has refrigerated truck, and then goes to storage, a warehouse that's refrigerated, and then goes to a retail market and it's refrigerated, if it's perishable, like fruits and vegetables, dairy, meat, etc. in a lot of the countries we work, that refrigeration is just not available. So there's huge contamination of various pathogens, Salmonella, E. coli, et cetera. And as diets diversify, as people gain income and diets diversify, it's those perishable foods that people are diversifying into that are most vulnerable to contamination. And this is also something that's not widely known. The global burden of disease from food safety is equal, from foodborne disease due to unsafe food, is equal to the disease associated with HIV or TB or malaria, which are the big three infectious diseases. So it causes that much death and disability comparable to those diseases. The economic estimate is $100 billion per year of the health cost from unsafe food. So huge, huge problem. And governments are increasingly recognizing it, and we're seeing, for the first time ever, national food safety plans from the governments where we work, so we're trying to support them in implementing those. Some specific examples of work we're doing in this area. So in order to try to decrease food loss, fruits and vegetables are very seasonal in their production, so you'd have a glut of tomatoes at tomato harvest, and then part of the year there's no tomatoes available. Same with mangoes, et cetera. So in Nigeria, again, we are supporting women-owned small-scale food processing businesses, which could be drying, pickling, et cetera, things, again, we take for granted, but to try to preserve the shelf life and nutritional value of fruits and vegetables so they're available with a more stable supply and retain their nutrient value, and are affordable to low-income consumers. Because you can do those kind of products, and we see them for higher-income consumers, like quinoa exported from Peru all around the world, sort of niche high-income products. But these are specifically products that need to be affordable for low-income consumers. So we're experimenting with various business models and how to do that. And it's a local Nigerian firm, a company that's leading that effort, headed by a young woman who's our grantee. So that's exciting, that's brand new. And then in terms of trying to support countries and setting up food safety systems, we're supporting the government of Ethiopia now to set up a food safety surveillance system. So we funded a lot of research in Ethiopia and other countries documenting where contamination of food is occurring. Now there's a sense of how big the problem is, which value chain, which pathogens, what can the government do about it. Setting up a surveillance system where they're doing regular monitoring of various value chains, measuring food for contamination, having the lab to be able to analyze that, and then know what action needs to be taken. It's a very nascent effort. It's just getting underway, but it's exciting to see that, because when I started working in this area, nobody was talking about food safety in these countries at all. So it's great to see governments prioritizing that. An African food safety agency was just approved by the African Union, which is like the European Union, just 2 weeks ago for the first time. So again, a sign that that issue is being taken more seriously. The third area that we work in, integrating nutrition into ag policies and programs. So this, again, is working with governments and also with private sector actors and NGOs who are in the agriculture sector and mainly focused on agricultural production to take nutrition into account and to measure the nutritional impact of what they do. So one example there is we actually pay for nutrition. We support the salary of nutrition advisors in ministries of agriculture in India, in Ethiopia, in Nigeria, and that's at the request of the government because they realize they should be doing more for nutrition, but they're not really sure how to go about it. So we fund an NGO who then embeds advisors in these governments. Eventually, in Nigeria, in fact, what didn't even exist is now there is a nutrition department that has a small budget in the Ministry of Agriculture in Nigeria. That didn't exist 5 years ago. So it's a slow process, but it starts to normalize the consideration of nutrition among the objectives of an agricultural ministry. There's also no Ministry of Nutrition in any country that I'm aware of. So often nutrition is seen as a cross-sectoral, cross-ministerial responsibility. So we support coordination mechanisms for nutrition across ministries of agriculture, social protection, education, health, and a lot of countries really need that so that they're not stepping on each other's toes, and they're all rowing in the same direction in terms of trying to improve nutrition through the efforts of their various ministries. We also support an NGO who works, it's called Tanager, and they work with agricultural projects throughout Africa to embed both women's empowerment and consideration of gender issues and nutrition within their organizations and then within their specific projects. Because we were being inundated with tons of NGOs coming to us, even businesses coming to us, needing help on how do we make our activities or our businesses more nutrition and gender sensitive, and it was just too much, so we sort of outsourced what we couldn't do for everybody to an NGO, and that's been going on for 7 years now and is going very, very well. We just funded a second phase of that. And then integrating nutrition into production and processing. So biofortification, as I mentioned earlier, crop breeding takes place around the world. All crops are continuously improved for yield, for pest and disease resistance, and we are trying to ensure that nutrition is also taken into account in those breeding programs so that ag research stations, both global ones and ones in country, are looking at issues like yield and disease and pest resistance, drought tolerance, but also content of vitamin A or iron or zinc within those crops. And there have been successes in increasing the micronutrient value of crops in staples like sweet potatoes, beans, cassava, wheat, that are increasingly being taken up by governments. And then fortification happens, so that's in the seeds, that's breeding in seeds, which are then planted into the ground with the higher micronutrient content. Fortification of commonly consumed foods that I referred to earlier, like wheat flour, maize flour, oil, and salt. That fortification is when the nutrients are added during processing. Like in the US, we have iodized salt. Often there's vitamin A and vitamin D in our milk, so it's that process of putting nutrients into the food supply. So this is not the work of my specific program, so I don't have as many details and examples, but a lot of that work on fortification works directly with companies that produce those foods and how to make sure that fortification happens during processing, and then how do they do quality checks to ensure that foods are being fortified to the level that they're supposed to be. The standards for fortification are set by governments. Governments have laws and regulations about which foods should be fortified and to what degree, what is the quantitative content of the micronutrient that they're aiming for. And that's it. Thank you very much, and happy to take any questions you might have.
Thank you so much. That was terrific. I have some questions, but I'll allow you to ask a question. I have lots of questions. Yes, go ahead.
What I hear about and see now, because I mentioned that we're seeing increased rates of chronic disease in these countries, where in the past they've just been focused on undernutrition, nutritional deficiencies. Now they're seeing chronic disease, overweight, and obesity. So I think there's going to be increasing attention in Asia and Africa to highly processed foods and what's in the food supply. Those foods are not regulated at all in terms of sugar content, salt content, additives. That basically, those regulatory systems barely exist. And I feel like that might be the next frontier. I mean, it is in the US, you see a lot more in the press the last year than I've ever seen. The term ultra-processed foods is now thrown around in everyday speech, which is interesting. I'm sure you have thoughts on that. But I think that's likely what will receive a lot of attention in the coming years, as rates of diabetes, kidney disease go up.
So I have a question. So I'm thrilled to hear that you're supporting governments in developing their own dietary intake surveys.
Yeah.
Can you tell us which 10 countries and
Yeah.
will the data be publicly available in the repository?
Yes. Nigeria, that's out. But it's a 500-page report on my desk that you can borrow. It's not online yet because they want to publish about it, but it should be within the year.
Okay. Others?
Ethiopia, not yet published, still analyzing data, but hope that will be published this year, I was told recently. Vietnam, Zambia. Zambia is published. Senegal, Niger. Kenya's isn't out yet. I mean, they haven't done their survey yet. I can't think of the rest right now.
So I have a follow-up question.
Yeah.
So dietary intake assessment in lower income countries is very time-consuming, very
Yes.
expensive, and
Yes.
lots of resources.
Yes.
So 2 questions. In addition to dietary intakes, are you encouraging governments to collect data on prices?
Yes.
And then do you have a program on biomarkers as an alternative to dietary intake assessment?
Yeah. Dietary assessment is very expensive. I've done it myself in multiple villages. It's usually done with what's called 24-hour recall, where you ask somebody what they ate the day before. And I've done it myself, and it takes a long time per individual. But it can be done. The surveys I just talked about, like in Nigeria and Ethiopia, have sample sizes of around 5,500 women and children. They usually focus on women and children. They're nationally representative. Some are representative at the regional level. They range, the surveys as a whole cost in the millions, which is usually not funded by the governments, but by donors. But with the current environment, that's also a very scary prospect. But it's a group of donors who gets together, who generally funds those. But yes, so we are also supporting countries in their collection of food market prices for themselves and calculating the metric on the cost and affordability of a healthy diet. Because FAO and the World Bank do it on an annual basis, but that's using data that the World Bank collects every 3 or 4 years, whereas governments are generally collecting either their statistical agencies or their ministries of agriculture, depending on the country, food price data sometimes it's every month, sometimes it's every quarter, but it's frequent, and it's on a lot of foods. We encourage them to expand their food list, so it's not just the staples, so it includes fruits and vegetables and what would constitute a healthy diet, foods that would be part of their own food-based dietary guidelines. But the issue is they're not willing to put it online for the most part. That's where the real sticking point is, because the FAO and the World Bank have asked several countries to share their data, and that's a hard no at this point.
Well, I'm not surprised because USDA has been very reluctant
Yes.
to put prices online as well.
Yes,
So they are not
even-
the only ones. It's
but-
happening here as well.
But some of those countries are actually putting their cost and affordability calculations online. So Nigeria now you can find it online. Nigeria now publishes a monthly bulletin on the cost and affordability of a healthy diet. And in August of last year, they debated a minimum wage law in their parliament, and the cost and affordability of a healthy diet was cited, and the data was brought to bear on the parliamentary discussion. So that was a real example of policy influence. And then we're also supporting the development of metrics that are less cumbersome than 24-hour recall, that are quicker surveys, like Gallup does a survey with the diet. Yeah. So there are other metrics that don't depend on full quantitative, but just are having either semi-quantitative or just qualitative, yes, no, did you consume this food in the last 24 hours? And those can be done in 5 or 7 minutes per person, so much shorter. Biomarkers would be the fortification team and the MNCH team. We don't focus on biomarkers, but yes, there is some work on biomarkers also at the foundation.
Another question, because I have more.
You can keep going. But I'd love to hear from all of you. Yeah. Supplementation, like vitamins, you mean, and minerals? Yeah. Again, those are generally through the health sector rather than the food sector. So that would be our maternal newborn child health team that I referred to on one of my earlier slides, like prenatal vitamins that are multiple micronutrients for pregnant women. They're working on some supplements for young children who are not growing and developing properly. Maybe they were malnourished, they were wasted, they've recovered, but their gut microbiome is out of whack, if you will. And so they're doing trials with various foods that can help restore the natural healthy microbiome of children and get them on a better growth trajectory. So there are trials on that too. But yeah, supplements, it's the Gates Foundation, so it's a very sort of technology focused. If a lot of people are here from the Gates Foundation that aren't me, you'd hear more about things like that, which I think of as silver bullets. Whereas the work we're trying to do looks at the entire food system and tries to address the constraints. But there's a lot of focus at the Gates Foundation on specific technologies to diagnose diseases, to prevent diseases, and to treat diseases. So that's where supplements would come in, more through that health sector lens. So we test interventions on a small scale and do a randomized control trial to see if they work before we would ever think of recommending them to a government or supporting them ourselves for any sort of large scale. So we're constantly going, we're reading the scientific literature, we're going to conferences, we're talking to colleagues to understand what's out there, what's working. And then we also are sent concept notes or PowerPoint presentations every day, almost every week, on different interventions. I can cure malnutrition. I hear that all the time. I have the product to cure malnutrition. So we're receiving things constantly and filtering through those and just making decisions on what we want to go forward with. But it's constantly iterating on various things. Yeah, you're right. There is a real lack of data. So we create it if we don't have it on a small scale.
I have a follow-up question to that. So have you maybe sponsored already a project looking at FAO food balance sheets and trying to establish a diet quality score for a given country based on food balance sheets, which are used as proxies for intake? Technically, it could be used to create an algorithm to do a diet quality assessment for a given country at country level.
That's interesting. So we support FAO in their food balance sheets. It's called the food and diet domain of FAO. But there's also GIFT, which is the food consumption data. And the food and diet domain combines the food balance sheets and the food consumption data. But we haven't done exactly what you said in terms of developing national level metrics, because the belief is that there are global level metrics that can be used and they could be adopted by countries for their own needs to follow their own food-based dietary guidelines. When we've examined food-based dietary guidelines that different countries develop, they're remarkably similar across them. There are some divergences, of course, but it is possible to develop a model for a healthy diet that takes into account many different countries and respects many different countries' own dietary guidelines.
More questions? I can go on. So I have like an existent. Go ahead.
Please. That's a real existential question. No, not in my career have we ever been in this situation. This is brand new and it's very recent and sudden. And it's heartbreaking to read email now, because every day I'm hearing from our grantees that we're funding that have laid off half their staff because a lot of their funding came from USAID, and there's just a real follow-on effect. So can they retain their basic core functions like accounting and communications and, to continue to operate as an organization, even though they might have a $5 million project with us? Like, that's an issue. So we have to meet with them and talk to them about that. But no, the amount of devastation that we are witnessing, I hope it'll be reported. There are projects that are underway now where people have devices in their bodies and they were just abandoned in the middle of a trial for a USAID funded project. I'm aware of that. People were were at food assistance centers and being fed 2 or 3 meals a day, and that's just gone. So there's going to be a lot of death and suffering from the withdrawal of USAID. Our budget, the whole Gates Foundation, is big. We're the biggest foundation in the world. USAID dwarfs us. I don't know what their budget is, but it's many, like factor of 10 or ours. It's so much bigger than us. So there's no way that even if we changed everything we were doing to fill their gaps, which we won't, we couldn't touch what's happened in terms. So it's a huge, huge tragedy right now.
I agree with that. I have a question here as well. So the Gates Foundation exemplifies, to my mind, what I would call a philanthropic approach, meaning it's pro bono, it's giving stuff out, vouchers, supplements, certificates, all this stuff. But you also mentioned in your talk a business approach, which is sustainable, market-oriented, where people value and pay for nutrition.
Yeah.
What's the future of that, and how can that be supported?
Yeah. So if something's going to be sustained, either a government has to take it on, although now that maybe is a less certain thing, or the private sector has to take it on. We view ourselves as working ourselves out of a job in the long term. The Gates Foundation will go away, I think it's 25 years after Bill Gates dies. So we will go out of existence. And so we have that in our heads as we are trying to, that's why we're making an increasing number of grants to African and Asian headquartered organizations, not just to NGOs in the US or universities in the US, but to organizations and universities in Africa and Asia. That's been a huge shift in my 16 years at the Gates Foundation. And we have goals around that. Like, I want X% of our budget to go directly to those organizations because they need to grow their skills and capacity to do this work and chart their own future. They can't just be subject to our agenda and what we think is important. So that's at the core of what a lot of us are committed to. I wouldn't say 100% of the Gates Foundation, but most of it now. I really believe we're taking that seriously. So it's beyond DEI. It's a basic philosophical approach to development that it shouldn't be our responsibility in the long term to decide how these economies and countries develop. It needs to be under the control of the countries themselves, and we want to give them the ability to do that.
Thank you so much. It was a fantastic statement of principles and faith in the future under very, very trying circumstances. Thank you for coming in.
Thank you all.